Hello, my name is Mrinalini Dey and I'm here in EULAR 2025 reporting for Room Now. And today I'm delighted to be joined by Dr. Elena Nikiphorou, who is a reader in rheumatology and medical education at King's College London. Thank you for joining us. Today we're going to be talking about some highlights of a topic which has gained more recognition at this year's EULAR, mainly around social determinants of health, mixed methods and epidemiological studies, and the fact that this seems to be gaining more and more traction and importance at each Congress. So first of all, thank you for joining me. Could you first of all maybe tell us your general highlights about what's being discussed at this year's Congress?
Thank you. I'm delighted to be with you reporting. So I'm really impressed by this year's scientific program. I think it's an incredible program. It has a really good mix, variety of really important topics. I was particularly happy to see that there was a lot of focus on socioeconomic determinants of health, sessions on health literacy, even on syndemics. And it's really great because we had an interesting meeting yesterday on a study group on syndemics. You were there, part of it. And actually a lot of the focus was on health literacy, and there are sessions later today and tomorrow around health literacy. And I think it's really great to see health literacy growing on the agendas. It's a very important issue. It has been linked with socioeconomic disparities. It's a modifiable factor, so it's really important to reduce health inequalities and promote equity, which EULAR is really striving for really hard. And indeed, we reflected on syndemics, which is a novel theoretical framework in the context of rheumatic diseases. It's been around for decades, but more in HIV. But it's really nice to see the recognition of its importance in RMDs. Sessions to follow later today. I'm delighted to be presenting there, so please come along.
And I think briefly, could you maybe highlight what we're expecting to see in this afternoon's sessions?
I think one of the main messages that will hopefully come out from the health literacy sessions and or those focusing on social determinants of health is that health literacy is not just a patient issue. It's more of a wider and shared responsibility between healthcare providers, policymakers, educators. With the way the healthcare systems are developing, the complexity of them, it's really important that patients have adequate health literacy to be able to navigate through these systems. And hopefully this will come across. And from the syndemic sessions and the comorbidities, all those are very directly relevant, as you will see later. I think we will get to understand the importance of mixed method studies and how we should be going a little bit beyond traditional epidemiology, using qualitative methodology to supplement quantitative methodology to more comprehensively understand what drives certain aspects of rheumatic diseases.
Great. And just a final question. If you were to pick out maybe one abstract that demonstrates this very, very well, I know we do a lot of work on this, obviously. What would you say people should go to as an example of what you've described today?
I don't want to reveal too much, but in the syndemic session, there will be a very nice abstract. I'm looking forward to hearing it. It's an oral presentation from our colleagues in Latin America, talking about the syndemic model they have applied in their region. So I'm really looking forward to that, but I won't say more.
Okay, well, great teaser. Okay, well, thank you for being with us today, Elena. If you'd like to hear more about what's going on here in Barcelona, do follow Room Now for further coverage. Thank you.